mortality is on the rise in the United States. KLTV7's Christine Guevara spoke with an OBGYN about the reasons for the spike and what women can do to reduce the risk.
A recent report from the CDC counted around 1,200 women who died of maternal causes in 2021. In 2020, that number was down 861, and in 2019, 754. Dr. Jennifer Newton with Four Seasons Women's Health says one reason is due to patients getting pregnant at a later age. She says around their mid-30s, which is considered a high-risk pregnancy. Another is an unhealthy growing patient population. Women are going into pregnancy with pre-existing health conditions like type 2 diabetes, chronic hypertension, and obesity.
And those pre-existing conditions significantly increase the risk of things like preeclampsia, gestational diabetes, C-section rates, and those complications in pregnancy increase the mortality rates.
But she says patients often forget about the fourth trimester, which is where postpartum depression can occur.
And so making sure you follow up for that postpartum visit, making sure you reach out to your doctor if you're struggling with weird thoughts, bad feelings, not wanting to take care of your baby, not bonding with your baby.
So when it comes to the first step of prevention, Dr. Newton suggests having a good birth control.
Avoiding pregnancy when you're not ready. When your body's not ready and you're not healthy yet, you need to be on good birth control, something that's reliable.
Another is to better your health before getting pregnant. And once you are pregnant, continue to stay healthy throughout.
So seeing your doctor, partnering with your OBGYN so that you can stay healthy while you're pregnant and optimize your postpartum outcomes as much as possible.
Christine Guevara, KLTV 7 News.
According to the CDC report, black women saw the highest of maternal mortality rate by race with 69.9 deaths per 100,000 live births in 2021. Studies point to a lack of access to health care and resources.